Good afternoon, everybody, and I'd like to welcome you to our What's Buzzin' at Georgia Tech webinar series, where we are bringing you webinars each week throughout the semester to just talking about different offices on campus and just letting them have an opportunity to discuss the programs and resources and different services that they have to support your student here at Georgia Tech. We know that this is a kind of a strange time during the COVID-19 season. However, we are making sure that you have all the information that you need. Today, we are joined by Dr. Ben Holton, who is the Senior Director of the STAMPS Health Services here on campus, and he is here to talk to you about what is STAMPS Health Services, what are some of the services that we offer, and he's also here to talk to you about COVID-19 and just provide some brief updates regarding that as well. And so just give me a moment. I will turn it over to Dr. Holton once we start the PowerPoint presentation. Parents and families, if you have any questions, please feel free to utilize our Q&A chat box. We will get to your questions after the PowerPoint presentation. Once again, any parents or family members on the webinar, if you have any questions for Dr. Holton regarding STAMPS Health Services or COVID-19, please direct those to the Q&A chat box. All right, and without further ado, I'd like to bring you Dr. Ben Holton, Senior Director of the STAMPS Health Services.
Good afternoon, everyone, and thank you for the opportunity to be here today and to talk with you. As Tyler said, I'm going to talk to you a little bit about STAMPS Health Services and then transition to talking about COVID-19 and the campus response, as I'm sure that many of you are interested in that. The services that STAMPS Health Services provided include primary care, women's health, psychiatry. We have a travel immunization allergy clinic. We do have an in-house pharmacy, a lab and radiology area. In our building, we have nutrition services with 2 dietitians, and there is a dental clinic in our building as well. It's an outside dentist who leases the space from us. So they're not part of our staff, but the clinic is available to students. Next slide, Tom. So primary care, in primary care, we provide care mostly for acute illness and injuries. We do routine physicals. We do travel visits. We do STI screening. We can do some minor procedures such as laceration repair, reduction of a joint, drainage of an abscess, things like that. Next slide. In women's health, they provide routine gynecologic care, contraceptive care, including IUD placement and Nexplanon placement. They do STI screening for women in women's clinic, and they can address acute complaints such as vaginal discharge, abnormal bleeding, lower abdominal pain, UTI symptoms, and things like that. Psychiatry clinic, they can manage acute and chronic psychiatric illness. They can diagnose and treat new onset of psychiatric illness. And the psychiatry clinic works closely with C.A.R.E, which is the Center for Assessment, Referral and Education, and with the Georgia Tech Counseling Center to provide the whole broad spectrum of mental health care, including an initial assessment through counseling and psychiatric care. Next slide. Lab and radiology and pharmacy. So in our diagnostic services area, we do have a lab. We can do CBCs, strep tests, mono tests, urinalysis. We do have a rapid COVID test that we utilize, and pregnancy test in-house. Other labs get sent to Quest labs, and the typical turnaround for labs that are sent to Quest is 24 hours. And in our radiology area, we can do plain x-rays. We don't do ultrasound or CT or MRI. Our pharmacy functions as an outpatient retail pharmacy, just like Walgreens or CVS Pharmacy, and it does accept most insurance. So I did want to talk about health fee versus health insurance, just make sure that everyone understands that. Every student who is registered for 4 or more hours pays the mandatory student health fee. That's part of the fees that they pay with tuition. It's $172 per semester for fall and spring, and it covers most care at Stamps, including unlimited visits with a provider in primary care and in women's clinic. It covers 3 hours of care in psychiatry. It covers procedures that are done in primary care. So if someone comes and gets a laceration repaired, they don't get charged extra for that. It does cover some of our common labs, like a urinalysis, a strep test, a mono test. Those are covered. STI screening for gonorrhea and chlamydia are covered by the health fee. Flu shots are covered by the health fee, and right now COVID testing is for our rapid test is covered by the health fee. Prescriptions are not covered by the health fee. Some labs are not covered by the health fee, particularly ones that get sent out to Quest. Some medical supplies like a splint, a wrist splint or something like that are not covered by the health fee. The student will have to pay for those out of pocket. Health insurance, every student should have health insurance if at all possible. Health insurance is going to be needed if they need to receive care outside of Stamps. If they get referred to a specialist, if they have to go to urgent care after hours, if they have to go to the hospital, they will need health insurance for those costs. The health fee will not provide any coverage in those settings. Georgia Tech does offer a student health insurance plan. It's through United Healthcare. For most undergraduates, that plan is optional. It is mandatory for some students as required by USG, and those students include graduate students who have a GRA or a GTA and international students on a J1 and F1 visa. Some small programs also require students to have health insurance, and they meet that requirement through the health insurance plan. If a student is in the mandatory category and they have a ACA compliant insurance plan already, they can waive out of the student health insurance plan. But they need to go to the United Healthcare website and waive out. Otherwise, they'll automatically get charged for the health insurance plan. Only if they're a mandatory student. For most undergraduate students, that does not apply. They will not get automatically charged for the health insurance plan. Only if they sign up for it, if they're an optional student. The advantage of the student health insurance plan is that it covers all out-of-pocket costs at Stamps. If you get a lab that we charge for, the student health insurance plan will cover that at 100%. If you get immunizations here that we charge for, it's covered 100%. If you get a prescription filled at the Stamps Health Pharmacy, is covered 100% without a copay if you have the student health insurance plan. If you go to an outside pharmacy and use the student health insurance plan, you would pay a copay just like any other insurance plan. Next slide. And you go to the next one. Appointments. So Stamps Health Services does operate on an appointment basis. Our hours are 8 to 5, Monday through Friday. We don't open until 9 on Thursday because we have some staff meetings from 8 to 9 on Thursday morning. Appointments are scheduled by going to health.govtech.edu, which is our webpage. That's for primary care, sports medicine, and a travel allergy clinic. For women's clinic and psychiatry clinic, for the dietitian, and for primary care if you don't want to use the webpage. you can call to schedule an appointment. Unique to this semester, with the advent of COVID, when you go to primary care clinic to schedule an appointment, you will schedule either a respiratory or a non-respiratory appointment. Respiratory appointments are intended for students who have symptoms consistent with COVID-19, so fever, cough, shortness of breath, sore throat, runny nose, chills, body aches, any of those. Non-respiratory appointments are for things not related to COVID-19 or that are definitely not COVID related, sprained ankle, a laceration, a traumatic injury, something like that. Those would be a non-respiratory appointment. You can go to the next slide. For after-hours care, we do have a nurse advice line where students can talk to a nurse. If you call our main number, which is 404-894-1420, and it's after hours, then one of the options in the phone tree is to speak to the advice nurse. And the advice nurse can help students figure out whether they need to go see someone urgently or whether they can wait till the next day, and can advise the student about steps they can take until they can come into the clinic. On our after hours webpage, we list urgent care centers that are nearby, and we list the local emergency departments that are nearby. And you can see the after hours, the webpage for the after hours there. It's health.govtech.edu/after hours. Mental health support, I did want to address that specifically. College is stressful in general. The pandemic has made that much worse. Georgia Tech does offer numerous mental health resources. C.A.R.E, which is the Center for Assessment, Referral, and Education, is the central point of access for all mental health and wellness needs. It's the starting point for all mental health care on campus, and it can be C.A.R.E can get your student connected to a wide variety of resources here at Georgia Tech. Next. And this is just a little schematic showing where C.A.R.E fits in. C.A.R.E is at the top. That's the starting point for any mental health complaint. From there, students can be referred to health initiatives where they can get health education, some nutrition advice, and they can also get connected with our with VOICE, which is our sexual violence prevention and victim support group. C.A.R.E can also get students connected with STAMP Psychiatry, and for a new patient in psychiatry, that's the way that they would get connected with psychiatry. C.A.R.E can get students plugged into the counseling center, and that's also how they would get started with the counseling center. And then C.A.R.E can also connect students to off-campus resources. All right, next. So operational changes for stamps in light of COVID-19. So mask and cloth facial coverings are required for everyone who comes in the building. Patients, visitors, and staff are screened prior to coming into the building. We have a temperature kiosk at each entrance to the building that checks temperature. Each student fills out a screening questionnaire prior to coming in for their appointment that asks about symptoms of COVID-19. Staff also complete that questionnaire before they come to work. We are using telemedicine when possible for all of our clinics, so that students don't have to come into the building if they don't need to. As I mentioned before, appointments in primary care are either respiratory or non-respiratory appointments. Students who have a respiratory complaint are given a point of care test, and respiratory patients and non-respiratory patients are seen in separate areas of the clinic to prevent any cross exposure. So I did want to talk briefly about testing on campus. Asymptomatic surveillance testing is occurring on campus. Our goal is to test everyone once a week. Our lab has the capacity to do a little over 2,000 visits or tests a day currently. There are 2 permanent sites where we're doing testing. One at Bobby Dodd Stadium, which is near East Campus. One is the Coran parking deck, which is near the West Campus. The housing complex is on West Campus. We also have mobile pop-up sites on campus that change from day to day to try to hit the areas of campus that are not covered by the 2 permanent testing sites. We're also using those hotspots to do targeted testing where we identify hotspots. So in the Greek, if a Greek house has a cluster of cases, if a dorm has a cluster of cases, we can take a pop-up site to those areas to test students there. And the turnaround time for the surveillance testing is in the range of 36 to 48 hours. Symptomatic testing is occurring here at Stamps Health Services with a rapid point of care test. Our capacity is limited and is primarily due to the limitations of the machine that we have. It takes 15 minutes for a test to run, and you can only have 1 test in the machine at a time. We had planned to have additional testing capability, but the federal government has rerouted the testing machines that we had sought to purchase to nursing homes, and that's delayed our ability to get those machines. So right now we're limited to, we have a limited capacity for our testing. Fulton County is providing a mobile testing site on campus on Tuesdays and Thursdays that can also be used for symptomatic testing. And we're adding the ability to do symptomatic testing at the pop-up sites to cover some of the overflow testing that's needed from Stamps, where we couldn't meet all of the need for symptomatic testing. We are also implementing testing for students who are in the quarantine space that Georgia Tech Housing is providing, so that those students don't have to leave that space in order to get tested. We are also doing contact tracing. We are limiting our contact tracing to the Georgia Tech community. We're not doing contact tracing beyond Georgia Tech. Our efforts are in cooperation with the Georgia Department of Public Health. The goal of our efforts is to get students who are positive into isolation and students who have been exposed into quarantine as soon as possible before they can spread infection to others. And we have about 25 to 30 people who are involved in our effort at this time. I will say that this is, contact tracing has been challenging given the volume of cases that we've had. And so the current situation, 227 cases have been reported since Friday. We've had clusters in several Greek organizations and some small clusters in some of our dorms. We have targeted our testing at those sites to try to identify everyone who might be positive and get them isolated. A couple of our houses Greek houses have limited access to the house only to people who are positive, and others have been moved out of the house, and visitors are not allowed. The Greek organizations have been very cooperative with our efforts to try to control spread there and try to get students quarantined and isolated as needed. And the question you may be wondering is, why is Georgia Tech reporting more cases than other USG schools, and that's because we're doing a lot more testing than anybody else is. And that was on purpose. We, in consultation with public health experts, felt like the only way we would be able to limit the spread of COVID-19 on campus is to try to identify cases as early as possible and to try to identify as many of those cases as possible. And so we set up this very robust surveillance program and are working very hard to identify cases and get them in isolation and contacts in quarantine as soon as possible. And we're hoping that will help us get this under control. Here are ways to contact stamps, health.gotech.edu. There is a contact link on the website. The main number is 404-894-1420, and my email address there is there as well. And I'll open it up to questions at that point.
Thank you so much for that presentation, Dr. Holton. And now what we'll do is open it up for questions. So parents and families, if you have questions, please direct those to the Q&A chat box. Let's see what our first question is. My student took a test last Friday and never received her results. She sent an email to mytest@gatech.edu as I directed and received no response. Was there a problem with testing Friday?
No, there was not a problem with testing on Friday. There was a problem with communication of results. So the original plan was that the surveillance lab would send their positive results to us here at Stamps Health Services, and we would communicate those positive results to students as soon as we received them, and that has been happening. The problem arose with negative results. They didn't have a clear-cut plan for communicating negative results, so there was a delay over the weekend for communicating negative results. That should be resolved at this point. What we've done is they're now communicating all of their results to us, including their negative results, and we're notifying students through our electronic medical record of their results. We don't, email is not a secure means of communicating health information, so we did not want to send results through email, so we're using a messaging application within our electronic medical record to send results. And at this point in time, all results that we have received have been sent out to students, and that includes, that was through testing done Tuesday, I think. So I think all results through Tuesday have been sent out to students. So if your student has not received anything, ask them to go to our patient portal, which is at health.gotech.edu. And in the upper right corner, there's a link for the patient portal. After they've signed in with their Georgia Tech ID and password, they'll be able to see messages and they can access their notification there.
Thank you so much for sharing that, Dr. Holton. The next question is, are you isolating students who have been exposed to another student with COVID-19?
So not to get technical, but just to make sure there's clarity of terminology. So isolation is for students who are positive for COVID-19, or not just students. Isolation is the term used for separating those who have disease. And yes, we are isolating students who have tested positive for COVID-19. Quarantine refers to separating those who've had exposure but who do not have disease. And yes, we are quarantining students as well who have had exposure to someone who tested positive, who have had what's called close contact to someone who's tested positive. So they are being quarantined as well. We recommend that for both isolation and quarantine, students go home if that's at all possible. But if they are a student in Georgia Tech housing, Georgia Tech housing is providing space for isolation and quarantine. Students in Greek housing, housing will assist with them as long as they have space. Students in Georgia Tech housing have priority over students in Greek housing, but so far we have been able to accommodate students in Greek housing as well.
Thank you for that, and that actually kind of leads to the next question. If you can, could you elaborate kindly on how many isolation rooms Georgia Tech has available and what is the current utilization rate in those rooms?
I think we have space to isolate or quarantine approximately 200 students, and last I heard we were about 50% capacity.
All right. What are you doing to extend hours and testing to accommodate 6 students? I hear that appointments are very difficult to get for students who are showing symptoms.
Yeah, so we're, I mentioned that briefly. We are trying to set up some overflow testing for symptomatic students through our pop-up sites. And right now we're thinking of having some of that be after hours and probably also a little bit on Saturdays as well.
Sharing that. And I know this next question, I know that you may not be able to go into exact detail, but a parent would like to know where are students sent once their test is positive in terms of the isolation house or housing, and then what options do they have for food?
So that Georgia Tech has contracted with a nearby hotel, and that's being used as an isolation and quarantine space. Housing provides food, 2 meals a day for them as well. They're meals that are catered by dining, and they bring those to the students and deliver them to them. They also have some space on campus in dorm rooms that are not being used. They're apartments actually that are not being used. That are being used for students who are symptomatic but don't yet have a positive test or haven't yet been able to get tested until we have a definitive answer about whether they have COVID-19 or not.
If a student is isolating in housing provided by Georgia Tech, is there a nurse that checks on them?
We have a medical assistant here at Stamps that is trying to calling the students that are in the isolation quarantine space provided by housing, yes.
Thank you so much for sharing that. Next question is a question of clarification. Could you please clarify testing locations, hours for ill and asymptomatic students? This site lists the times, but students got a text today saying parking lot tests were from 1 to 5 p.m., not 9 to 5 p.m. Also, can weekend testing be more available? Some students struggling with attending classes / video online classes during Monday through Friday, so it's tough to balance the testing schedule.
Yeah, my understanding of the hours for the permanent sites is that they are 9 to 5. So I'm not aware of this change today from 1 to 5 instead of 9 to 5. I don't know if that. I don't think that's a permanent change. It may have been an adjustment just for today. We are working on setting up pop-up sites that would stay open till 6:30 or 7 in the evening. The way that would work is that some of the hours at those pop-up sites would be designated for asymptomatic students to utilize, and some of the time would be designated for symptomatic students. The goal being to try to keep those who are symptomatic separate from those who are asymptomatic. There is also a plan to set up some hours on Saturday, probably Saturday mornings for 2 to 3 hours.
Sounds good. Sounds good. Great news to hear. Of the 250 or so students that have received a positive test result since the fall restart, can you provide a sense for the number of cases that are asymptomatic, mild, medium, or severe, including requiring hospitalization?
At this point in time, we're not aware of any students who have been hospitalized. And the vast majority of cases have been mild. I've not heard of anyone who is seriously ill. But we don't have strict data on breaking them down into mild, moderate, or severe.
Do you have any sense of the numbers since August 17th, since the first day of class? How many positive tests we've had?
I'd have to go back and count. The first few days after class started, we had relatively low numbers, 10, 15, something like that. It was not until Friday or Saturday, actually, where we saw an uptick in numbers that started.
Thank you so much for sharing that. A parent has expressed that they are concerned about sending positive resulted students back home. Does that increase the risk to the at-risk family members?
Yes, there is some risk, but most families, and not all families, and this would be something that we take into account, most families would have, it's much more likely a student could isolate or quarantine in a room by themselves and have access to a bathroom that only they're using in their own home, as opposed to here. They in a dorm room where they have a roommate, that's not going to be amenable to quarantine or isolation. In a dorm room, you have to use a communal bathroom down the hall, it's not going to be amenable to quarantine or isolation. The Greek houses typically do not have space where someone could isolate or quarantine in a room by themselves and have their own bathroom. And the number of people that they could expose is much greater here than they would at home. So yes, there is some risk, but we think that risk is less in terms of there's greater ability to isolate and quarantine effectively at home than there would be here at home. And they're less likely to come, or the number of people that they're likely to come into contact with would be much less than here.
Sounds good. Yeah. And Dr. Holton, I know during your presentation you spoke about flu shots being offered through the student health fee. And so we know that they will be offered this year. However, we would like to know, when will GT start offering the flu shots?
Yeah, we'll start offering them in September in the clinic. So when a student comes to a clinic visit, we'll offer them a flu shot while they're here. And then in late September and in October, we are planning, we're working on planning a large flu clinic that would be open to all of campus. COVID-19 presents some challenges to doing that, so normally that would be offered here at Stamps, but we're working with a site on campus that would allow us a much greater ability to spread people out and do the social distancing that would enable us to do a large-scale event in a safe way.
Great, sounds good. Can my student use her insurance on the parent's plan via the employer for pharmacy prescriptions at the Stamps pharmacy?
In general, yes. We don't, if your insurance is a common insurance, then yes, the answer to that would be yes. We're not on every insurance plan's formulary or list of pharmacies, but the vast majority of them we are. And that's true for the pharmacy. For stamps itself, for medical care, we only accept the student health insurance plan. Otherwise, students will have to pay out of pocket for any expenses here, and they could then submit that for reimbursement to their insurance company.
Thank you so much for sharing that, Dr. Holton. This next question is a pretty interesting one. It says, my son tested positive and is currently in the off-campus hotel. His only symptom is no sense of smell or taste. Does he count the 10 days from when he noticed the symptom, same day he got the results, or does he count from when he gets his smell back?
So isolation, you can end isolation when you've gone 24 hours without a fever, symptoms are improved, and at least 10 days have passed since symptom onset. So he could end his isolation, assuming hasn't had a fever and his symptoms are better, he could end his isolation 10 days after he lost his sense of taste and smell, if that's his only symptom.
Okay, great. Thank you for sharing that as well. Does STAMPS provide COVID-19 antibody testing?
We can send antibody testing to Quest. It is not covered by, we are not providing antibody testing free of charge, only the rapid test free of charge. You know, right now the state of knowledge about antibody testing is it doesn't help us a lot. The only thing you can say based on antibody testing is that you have been exposed and you've developed antibodies. We don't know at this point in time what level of antibodies provides protection, if at all, and we don't know how long that protection lasts. You cannot use an antibody test to say that someone is safe to be out and about, that they don't have to worry about getting COVID-19. You can't use it to say they're safe to attend class, football game, or to hang out in their dorm with others. The only thing you can say based on antibody testing is that you've been exposed, you developed antibodies, and that's really it at this point in time, based on our current understanding of antibodies.
Great. Thank you for sharing that as well. How long are asymptomatic positive patients quarantined at Georgia Tech?
So for individuals who do not have any symptoms but have tested positive, they have to isolate for 10 days from when their test was taken. Not from when they got the results, but from when their test sample was taken.
The next question is, will you publish a list of alternative residence halls / hotels if my student is asked to leave the dorm when tested positive?
There has not been discussion of that. An alternative dorm is not an option. The only hotel that we have an arrangement with is the one through Georgia Tech Housing. We have not made arrangements with any other hotels that students could go to. So that would, if they're not going to go to the hotel provided by Georgia Tech Housing, that would be something they'd have to arrange on their own.
Right. And I think Georgia Tech administration, just in the best interest of the student, we're trying to keep that location discreet at this time.
That's correct.
Great. Can you speak to the protocol if a off-campus student tests positive? Are they sent to the hotel and charged for accommodations and food?
Off-campus students they quarantine or isolate in their off-campus residence. we're not providing space for those students. Well, let me clarify that. Some people consider Greek housing as off-campus. If they are in Greek housing, as long as there is available space, we will try to assist Georgia Tech Housing will try to assist them with providing space to isolate or quarantine. But if a student has an off-campus apartment, they would need to quarantine in their off-campus apartment.
All right, thank you so much for sharing that, Dr. Holton. And just for a few parents who may have joined the webinar late, would you mind just explaining again the difference between isolation and quarantine?
So isolation is the term that's used for separating someone who has disease, who's been diagnosed with COVID-19. Quarantine refers to the process of isolating someone who has had exposure to someone who's has COVID-19, but they themselves do not have disease, have not tested positive. So isolation for those who have disease, quarantine for those who have exposure.
Thank you again for just pointing that out to us. Why is it easier to get tested when you are asymptomatic, whereas when you are symptomatic, testing is more limited? I would think that it is important to test one if they are symptomatic.
It is, and we're working on trying to make that more available. We had, as I mentioned earlier, we had thought that we would have additional capacity for symptomatic testing at this point in time. So we're having to make alternative arrangements to increase the availability of testing for symptomatic students.
The next question that we have for you is, do you recommend getting the rapid / nasal swab test to confirm a positive saliva result?
No, the saliva test that they're doing in the surveillance lab is it's the state-of-the-art, gold standard PCR test, and it is very sensitive, and it's not necessary that someone get retested with the nasal swab test. There's actually some research that shows that the saliva test is more sensitive for COVID-19 than a nasal swab test. It's less susceptible to getting a poor sample. If people don't tolerate the nasal swab test very well, it is easy to not get a very good sample and therefore get a false negative with the nasal swab. So we are not recommending retesting with the nasal swab at this time after the saliva test.
All right, thank you for sharing that. That's good information to know. The next question is we have from a parent, can students be given more meals in isolation locations other than just 2?
That's an arrangement that housing makes. I know they have received some feedback about that, and I've shared some feedback about that. But and I think they're trying to work on that. That presents some logistical issues, but they are trying to at least, if not have a full third meal, to provide snacks and things like that for students.
Next question that we have for you is there a way for local parents to help, such as supplemental food delivery to the hotel, volunteering to help with contact tracing, etc.?
If you have a student that's in the isolation or quarantine dorm or hotel, and you want to bring them food, I think that I don't think there's an issue with that. You probably would not be able to go up and see your student. They are trying to limit or not have visitors there, but you could drop it off to be delivered. We haven't thought about contact tracing, getting parents to help with contact tracing. Interesting thought. It's worth considering.
Yes, I can imagine, and just thank you to the parent for offering to volunteer your time. Can you expand on your approach for the amount of time a student is being asked to isolate. We have heard a student's time being changed midway through. While I know each person's case is different, probably unique perhaps, can you clarify at what point a person's isolation clock begins and ends?
So isolation begins, well, someone is in isolation for 10 days after their symptoms start, assuming that at the end of that 10 days, they've gone without fever for 24 hours and their symptoms are improved. And that also is assuming they've had mild to moderate illness. The current guidance from the CDC does delineate two different time frames based on the severity of someone's illness. Since the vast majority of our students have mild to moderate illness, we're using the 10 days. But if someone were to have severe disease, and the CDC defines that as requiring hospitalization, requiring ventilator support, requiring oxygen support, those individuals, it's recommended that they actually wait 20 days from symptom onset before they end isolation. Also with the caveat of no fever within 24 hours and symptoms are better. But for our purposes, since really all of our students, at least so far, have had mild to moderate disease, we're using 10 days. Quarantine is for 14 days from last contact with the person who is positive. And sometimes there's confusion about why am I in quarantine for 14 days when the person that I had contact with is only in isolation for 10 days. And that's because the length of time is based on two different processes. Quarantine, the length of quarantine is based on the incubation period of the virus. The incubation period of the virus is the time from when you get exposed to when you might get sick, when you might develop illness, and that's 14 days. And so you have to stay in quarantine that entire 14 days. Isolation, the length of isolation is based on how long it takes to recover from illness once you've become ill. And that period of recovery, at least based on current evidence, is believed to be 10 days. The evidence points to that the vast majority of people, 10 days after the onset of symptoms, are no longer infectious to others. And that's where those two timeframes come from.
Thank you, Dr. Holton. We appreciate you for providing that insight. This parent will also like to say thank you for looking after our students as well. On that and your staff. Does someone find out about more pop-up testing locations and hours as they come up throughout the semester?
I'm sorry, I missed the beginning of that question.
How does someone find out more about pop-up testing locations and hours?
Well, let's see. If you go to our website, which is health.gautech.edu, there is a tile right there on our homepage that lists the COVID-19 testing sites. It lists the permanent sites, and it lists the Fulton County site, and there's a link to more testing information as well. And on campus, they have signs up, and they have postings for when and where the pop-up sites are.
Great, thank you for providing that information for us. What happens if you run out of isolation/quarantine space? Would that prompt GT to move to online classes?
That would be a factor in making that decision, absolutely. We are working on trying to make arrangements with a second hotel so that we have additional space. Because students, because of the fact that many classes are online, or students have a hybrid classes where they don't have to be on campus very often, the number of students that are in dorms is lower than normally would be the case. And so we also have some additional space in our dorms that isn't currently being used. So that gives us some expansion opportunities for providing isolation and quarantine as well. But if we were to max out all of that, that would be a factor in making the decision about whether we continue with on in-person class or not.
Thank you for sharing that. The next question is, and I know you spoke about this earlier, it seems like we have just a question for clarification. If a student tests positive during quarantine at the hotel, can they leave and go home?
Yes, they can. They can leave and go home. They can leave if they get moved to the hotel for quarantine and they decide they would prefer to quarantine at home. They can leave the hotel and quarantine at home, as long as they don't have to use public transportation to get home. So if they have their own car, they can drive home, or if mom and dad can come pick them up, they do not have to stay in the hotel if they're going to a location where they can quarantine or isolate appropriately. They could not return to campus, however, until they've fulfilled the quarantine or isolation requirements.
Thank you for providing that clarification. Dr. Holton, thanks to you and your team for all the hard work you do to protect the students and employees at Georgia Tech with a remarkable effort at this difficult time. So I think we just have a compliment from a parent in the audience.
Well, thank you. There are a lot of people who are working really hard to try to make this happen for the students.
The next question is, do we have a COVID-19 goal, a maximum percentage of positive students that we're trying to achieve?
No, we don't have a goal that we're trying to achieve. And there is not one number or one factor that is a trigger that would move us toward going to online only classes or to doing remote learning only. There are a multitude of factors that would be taken into consideration in the decision making regarding whether we go to online learning or not. And the important thing, I think it's also the important thing is that it's more than just going to online learning if we get to that situation. Right now, transmission on campus is not occurring in classrooms. It's occurring in social settings. And going to online classes only doesn't solve that issue if everybody stays on campus. So if we are to reach that point, it would be just as important that people leave campus and that we de-densify campus so that there are less close contacts. That's the only way we would interrupt this spread.
All right, it seems like we just have a few more questions. Is a student being quarantined because they were in close contact with someone positive? Are they identified as being positive as well, regardless if they have been tested or not? If the exposed student has no symptoms, is the quarantine time 10 days or 14? And how do you determine the day students can return to campus? So I know you spoke about this earlier, but I know we've had a lot of people tune in late. So if you wouldn't mind just explaining that again, Dr. Holton.
Yeah, so when a student tests positive for COVID-19, they are put into isolation, either by going home or by utilizing the housing provided by Georgia Tech, or by, if they live off campus, isolating in their off-campus residence. And if they're in isolation, if they've tested positive, they're having symptoms, they're in isolation for 10 days after their symptoms started, or if they tested positive and they did not have symptoms, they're in isolation for 10 days after their test was taken. Students who had close contact with that person who tested positive are put in quarantine, and they are in quarantine for 14 days from their last contact with that person who tested positive. They may not be in quarantine for a full 14 days from when we call them and notify them that they need to quarantine. It's 14 days from when they had that contact with the person who's positive. 14 days from when the last chance they had of exposure to the virus.
Great. Thank you so much for just sharing that again. In practical terms, we know isolation and quarantine are in different places, and the long amount of time before moving out of that time is different with isolation as well. So essentially, when you're talking about quarantining and isolation, besides the nurse or perhaps the regular testing or perhaps just someone calling to check on them, are there any other differences that a student in quarantine may not get because he's not in isolation in terms of the services?
No, they're treated the same. Students in isolation and students in quarantine get the same services.
Okay, great. And I have another question as well. If my student tests positive, does your office call me, the parent, to notify me? And also, do I get to have the details of the exact hotel my student is staying?
We do not call the parent unless the student asks us to. For most students, since they're 18 or older, from a federal law standpoint, they are considered adults, and we cannot release their medical information even to parents without their permission. Now there are subtleties to that. If they were seriously ill and were not able to communicate with their parent on their own, then yes, we would communicate with the parent and let them know. But assuming the student is mildly ill, able to communicate with their parent on their own, we would not automatically notify the parent. If they asked us to, absolutely, but they have to give permission for us to talk to the parent.
Great. And it seems like we have just a couple compliments, another few compliments. I've been so pleased with the level of communication and transparency in regards to COVID-19. Thank you to everyone at the Stamps Health Services for your hard work. Thank you for your answer on parent volunteers. I think you may have a great response if needed, so please do consider how local or even non-local parents, can help you out. And I think we have two more questions, Dr. Holton. Just hang in there for me. After a student tests positive and has isolated for 10 days, what happens if a student is exposed again? Do they essentially have a free pass for 3 months, meaning they are not required to quarantine since they already had COVID-19?
Yes, so this is a great question, and it brings up a couple of things. So yes, according to the current guidelines from the CDC, if someone has had confirmed COVID-19, meaning they had a positive test, for 3 months after that positive test, if they have contact with someone who is, and they've recovered from their illness, for 3 months after that illness, if they have contact with someone who is positive, they do not need to quarantine. And it's believed, and that is true because we think, or at least the current evidence is that within 3 months, reinfection doesn't appear to occur. Now, if within that 3 months they were to develop new symptoms, then that might change that course. But just contact with someone who's positive within 3 months of already having had COVID-19, you do not need to quarantine again. Related to that, or similar to that, once you've tested positive for COVID-19, The current recommendations from the CDC are that you not get retested for COVID-19 for 3 months as long as you remain asymptomatic. And that's because there is a phenomenon where people can test positive for COVID-19 for an extended period of time after having COVID-19, but it does not mean that they continue to be infectious to others. It's believed that the test picks up RNA fragments that are left over from the virus. So for individuals who've tested positive for COVID-19, as long as they remain asymptomatic, they should not retest for 3 months after that positive test.
Great, thank you for sharing. That actually leads to a follow-up question that I have as well. So if I test positive, hypothetically, for COVID-19 today, how long am I infectious to others? Is there a certain day or time frame that I'm infectious or contagious? Is there any research on that?
Yeah, so that's the CDC's current recommendations for 10 days is based on evidence that suggests that after 10 days after symptom onset, those with mild to moderate disease are no longer infectious to others. Okay. Or the vast majority of people are no longer infectious to others.
Okay, great. And the last question that we have is, how many tests have been done to date?
Updated 2 days ago, 13,050 tests have been done through the surveillance site, and of those, 217 have been positive. That's the most current numbers that I have. That's from the website that's available at health.gautech.edu/surveillance testing program results.
Great, thank you so much, Dr. Holton. And that pretty much wraps up our questions. Dr. Holton, do you have any final remarks or just any lasting words to our parents and family members that are attending the webinar today?
I thank you for all the support that we've received here. We are learning as we go, and we are every day trying to make things better for students in terms of this COVID-19 and the processes that we're using. People have been generously offering ways in which we could improve, and we take those to heart. I would ask you to encourage your student to make sure they wear their mask anytime they're not in a room by themselves, that they keep 6 feet distance from those around them. When they sit down to eat, try to spread out. You might have to talk a little bit louder, but you can still have a good conversation 6 feet apart. And also that they encourage their student to take care of themselves, to get outside, get some fresh air, hang out with their friends in ways that protect them from infection. Go outside on the lawn, spread out, enjoy each other's company, but do it in a way that doesn't lead to increased infection. The way not to do it is to sit in a dorm room, nobody wearing a mask, snuggled up close, watching a movie with 10 or 15 people in the room, or that sort of thing. Try to get outside, spread out, and enjoy each other's company in a safe way.
Great. Thank you so much, Dr. Holton, just for your time, for your diligence, and just for sharing so much good information with us. We know that this is a strange time that we're living in right now in the world and in America, and so we appreciate you and your team and what you're doing to keep our students safe on campus. And just to kind of reiterate some of the things Dr. Holton spoke about, I know our administration would love for you as parents to kind of help us encourage your students to get tested regularly. Just having them include going to get tested in their weekly routine if they can. That is something that the president and our dean of students would really like to encourage parents to have that conversation about making sure your student is taking the time to go get tested weekly. We have the capacity, we have the means, and so we just need your help in partnering with that. Thank you so much for attending today's webinar. A recording of this webinar will be available on our website within the next 24 hours, parents.gatech.edu. If you go under the Stay Connected tab, you'll see virtual recordings. Please join us next week, parents. I know many of you have questions about dining. Dining operations team will be joining us next Tuesday at 12 p.m. The link is also on our website as well, under the Stay Connected tab for virtual recordings, where you'll see the full schedule of our What's Buzzin' at Georgia Tech webinar series. So please mark your calendars for next Tuesday, 12 p.m. We'll have answers and information about dining for you. But once again, thank you for attending today's session, and have a great weekend, and go Jackets.